Today, we're talking about Cutar Emulsion, a medication used on the skin to treat itching, scaling, and flaking due to skin conditions such as psoriasis or seborrheic dermatitis. Cutar Emulsion contains coal tar, which belongs to a class of drugs known as keratoplastics. It works by causing the skin to shed dead cells from its top layer and slow down the growth of skin cells. This effect decreases scaling and dryness, and also helps to decrease itchiness from these skin conditions. It is recommended to apply the emulsion to the affected areas once or twice daily, and it is best to use it at the same time each day for optimal results. When using Cutar Emulsion, it's important to follow the directions on the product package. Be sure to check the label to see if you need to shake the product before using it. If you have any questions, it's best to ask your doctor or pharmacist for guidance. This medication is meant to be used on the skin only. Avoid getting it near your eyes, nose, mouth, groin, or rectum to prevent irritation. If it does come into contact with these areas, rinse with cool water for 15 minutes and wash your hands after use. Apply a small amount to the affected area and gently massage it in. Your doctor may recommend using it 1 to 4 times a day. Let it air dry before putting on clothing, and do not apply to broken or infected skin unless directed by your doctor. If using it on the scalp, follow the package directions. Coal tar products can also be used in the bath or as a hand/foot soak, but be cautious as they can make surfaces slippery. The dosage will depend on your medical condition, product type, and response to treatment. Use Cutar Emulsion regularly to get the most benefit from it, and try to use it at the same time each day to help you remember. If your condition persists or worsens, or if you have concerns about a large area of skin being affected, it's important to seek medical help. Skin and scalp irritation, as well as staining of the skin and hair, especially in patients with blonde, bleached, dyed, or gray hair, may occur. If you experience skin irritation, stop using this product and consult your doctor or pharmacist. If your doctor has prescribed this medication, it is because they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. Long-term use of this product can lead to hair follicle problems, such as tar acne. Contact your doctor if you notice new skin bumps or acne in the treated area. Although rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Contact your doctor or pharmacist if you notice any other effects not listed here. In the US, call your doctor for medical advice about side effects. You may also report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before using Cutar Emulsion, make sure to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Let your doctor or pharmacist know about your medical history before using Cutar Emulsion. Cutar Emulsion may make you more sensitive to the sun, so be sure to wash it off completely before any light treatment or sun exposure, as directed by your doctor. Avoid sun exposure, tanning booths, and sun lamps for at least 24 hours after using this medication, unless your doctor tells you otherwise. Other medications may also increase your sun sensitivity, so ask your doctor or pharmacist for more details. If you get sunburned or have skin blisters/redness, be sure to tell your doctor right away. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Cutar Emulsion should only be used when clearly needed. Discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using Cutar Emulsion, it is important to be aware of potential drug interactions. These interactions can affect how Cutar Emulsion works and may increase the risk of serious side effects. To minimize the risk, it is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It is crucial to follow your doctor's approval and not start, stop, or change the dosage of any medicines without their guidance. This will help ensure the safe and effective use of Cutar Emulsion for your skin condition. If someone accidentally swallows Cutar Emulsion, it could be harmful. If they have serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can contact a provincial poison control center. Always be cautious and keep this medication out of reach of children to prevent accidental ingestion. Be careful to not let Cutar Emulsion touch your clothing before it dries, as it may stain. It is important not to share this medication with others if it has been prescribed specifically for you. If you forget to take a dose, you can take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take double the dose to make up for the missed one. When using Cutar Emulsion, it's important to store it at room temperature. Different brands may have different storage requirements, so it's best to refer to the package labeling or ask your pharmacist for specific instructions. Some products may contain alcohol and are flammable, so be sure to keep them away from heat, open flames, and smoking. It's also important to keep all medications away from children and pets. When it comes to disposing of Cutar Emulsion, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure of how to properly dispose of it, consult your pharmacist or local waste disposal company for guidance. As for the benefits of Cutar Emulsion, the medication is used to treat certain skin conditions such as psoriasis and seborrheic dermatitis. It works by causing the skin to shed dead cells from its top layer and slow down the growth of skin cells. The daily dosage and optimal timing of Cutar Emulsion will depend on the specific condition being treated, so it's important to follow the instructions provided by your doctor or pharmacist. Typically, it is applied to the affected area once or twice daily, or as directed by your healthcare professional. Be sure to wash your hands after applying the medication and avoid getting it in your eyes or on mucous membranes. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.